didn't have much of a vision because we really didn't know what the government was looking for. What they did was announce that they were going to try to experiment with how they fund healthcare, health research, construction, things like that, more efficiently, and they were going to award 6 contracts to different communities who applied. So it was a very both daunting and enchanting thing to go after, and Philadelphia did. As you know, the board was the challenge. We had to have what was called the 4 Ps: political, provider, payer, and public. The big surprise was that it was a shoemaker from Point Breeze who had the sort of natural wisdom of how you deal with all these competing forces. It's like a diamond in the raw. And there wouldn't be PHMC as you know it today were it not for him. But what we did is looking for partnerships in the community and gradually built a set of relationships that each had, a slightly different theme, but nonetheless we're all in the business of improving healthcare. I'm Jack McMeekin, born and raised in Philadelphia, retired, spent about probably 35 years in healthcare, including 5 years here as the first executive director.
When I was health commissioner back in the 80s, we were trying to imagine what could help build not only a legacy for public health, but a whole data solution. We contracted with PHMC, and it was their idea to develop a database of what our community looked like from a health, a mental health, a drug and alcohol perspective. And we gave them a small contract to begin to design and collect data. This database has now continued for the last 40 years, and it provides an invaluable resource to looking at where we're at and to helping design new solutions to real health problems and public health problems in Philadelphia.
The partnerships are probably the most important part of relationships between the state government, the city government, and organizations like PHMC. And I say that because the government doesn't do services. The way you get direct services and you do them well is you partner. You partner with different kinds of entities. You partner with the community-based nonprofit, and you partner with those larger organizations that actually help the state and the city by being your agent and being your primary partner. PHMC was one of those primary partners. In other words, the Department of Health and the Department of Public Welfare partner with PHMC so they could help partner with the smaller agencies.
I think that in this age of collaboration, more and more people have realized that partnerships are critical to accomplishing large-scale goals. PHMC has a very strong track record in terms of its own accomplishments and also in terms of the partnerships that it has developed. Those include the Reinvestment Fund, the Delaware Valley Association for the Education of Young Children, United Way, many, many organizations in this city. Also, PHMC has stressed the importance of good leadership at every level, actually, in the organization, and that shows, and that's important to William Penn when we choose partners.
The most important lesson I have learned from dynamic team members at PHMC is that service that is delivered to the client should not be differentiated by their income status. Everyone is entitled to be treated well, and they should have access to first-class facilities. People work and feel more at home if you're within the organization, and it's allowed the organization to richly develop different approaches, ideas, and concepts that have led to better delivery of public health services.
Well, I think the first thing you got to do is define what you mean by public health. So I'll interpret that to mean as to make the population for whom we take care and who live amongst us, help them to be as healthy as they can as individuals and as a community. And in a neighborhood like North Philadelphia, where the folks are challenged, and this is one of the areas of deepest poverty in the country, there are a lot of challenges that our patients face. From our perspective, we were seeing a whole number of people in the emergency room who really could be seen in a different setting, much more effectively in a different setting, much more quickly in a different setting. We approached PHMC about the idea, and they picked right up on it. They saw the opportunity from their perspective to serve a group of patients in a different way than they may have before. And I think their innovative spirit and creativity are in evidence in the partnership we have with them. This is a new idea.
Congresso is located in eastern North Philadelphia, which statistically is deemed one of the poorest regions in the city. We believe in Congresso that they deserve the best care, the best services, from prevention to intervention. The expertise that PHMC has provided to us is invaluable. We've learned a great deal as it relates to operating a health center, and PHMC has really invested not only resources but time to be able to deliver culturally sensitive and culturally sound medical services. With the partnership of Congresso and PHMC, I know the community is in excellent hands.
When I think back to, again, my time in public service, whether it was working on indoor smoking, when I think about working with our seniors and vulnerable populations, when I think about children who need more out-of-school time activities, PHMC was the manager for our out-of-school time programs. They worked with us in social service agencies, the Department of Human Services, when we instituted improving outcomes for children. These changes take place not only because the government is trying to move in a different direction, but that we have a well-known, a highly respected, and actively engaged partner like PHMC working with us. We benefited as the City of Philadelphia by having that kind of strong relationship with PHMC.
So what PHMC wanted to do was really invest in their leadership for sustainability, succession planning, for the future. So if I thought about what differentiates or is unique about the program, it certainly is the first of its kind by having an emphasis in organization development and change, and then also nonprofit leadership and the nuances around public health. What we're doing is really investing in leaders to think differently, to practice differently. People are coming into the classroom, they're connecting with people across PHMC that perhaps they've never met before. And then they're learning from those interactions that people have similar passions and similar ideas around different projects that they can engage in. This powerful collaboration is going to make a difference within the system, and then also have an opportunity for both organizations to reimagine some of the possibilities as we go forward.
The world is changing, policy is changing, healthcare is changing. We're at a historic time, and to that end, I think that looking 45 years ahead and preparing for that future, it's all about collaboration. It's about resource, but it's all about collaboration. How can we do more together? Our needs are only going to grow. Children's needs are only going to grow. Reimagining this means that everybody, no matter where they come from, has access to the very best care. And it's up to our generation, it's up to us to help meet that need and to help give them everything that we possibly can to succeed in life.
The reimagining of public health is probably in some ways synonymous with what PHMC has done over their 45-year history. It means continuing to look at health data and continuing to communicate to families and to providers around what's going to make our future healthier. So reimagining for PHMC actually comes very, very naturally because it's what they've built their reputation on and what they will continue to do in the future.
So if we're going to reimagine public health for the future, we need entities like PHMC invested in finding a secret sauce and take the effective use of resources to work on very critical things like infant mortality, life expectancy, and making people feel safe.
The quality of your life really does revolve around the quality of your health and the ability to take care of yourself, deal with all kinds of issues that any one of us may have from a genetic or hereditary standpoint. But there are ways to deal with these kinds of issues, and I have no doubt in my mind that PHMC will continue to reimagine what public health means, not just here in our city, not just in our state. We'll be a leader across the United States of America. That's their focus.
PHMC, when it got started back in the 70s, was struggling to find its role, its mission. To its credit, and to its leadership, it survived that sort of birthing period to today, where you have a very large, very sophisticated, very sound PHMC as the successor to that troubled time. Interestingly, I mentioned in the beginning that the government said there are only going to be 6 of these grants, if even that many. Philadelphia, PHMC is the only surviving 45-year later Estes grant.